Hello, and welcome to today's webinar on STI screening and counseling. My name is Jennifer Boniface, and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects for the Medicare preventive services of sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections. I have a few housekeeping items to go over with you before we start the webinar. You can find a link to the encore presentation of this webinar on our website's Training Center page on www.wpsgha.com, and it will be accessible for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist, and both should be available within the next 15 business days. If you have any questions, please put those questions into the chat feature and select Send to all panelists. We will answer questions as time permits. Should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterward. We really want your feedback. It helps us develop education on topics that may be of interest to you. So consider taking our survey to let CMS know what you did like and what topics you'd like us to present more and learn more about. Mary Sue will place a link to the chat in the chat for the survey. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while viewing the encore presentation. And to access that survey, just click the circle with the eye in the upper right corner of the video. A link to the survey can also be found in the description of the video. On this next slide, we have our disclaimer. Medicare rules do change often, so please make sure you're looking at an official CMS communication for the most up-to-date rules and regulations. And these do take precedence over anything as presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on our Training Center page of our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. On this next slide, you'll see a list of acronyms used in this presentation. During the presentation, if there are any acronyms you are unfamiliar with, please take a look at this slide for the definition. Most sexually transmitted infections can be prevented and treated, with many of them being cured. STI Awareness Month is recognized throughout April to educate the public about sexually transmitted infections, their prevention, and the importance of regular screening. STI Awareness Week is an important part of STI Awareness Month and is typically observed in the second week of April. This week is focused on increasing awareness through education, promoting prevention, and addressing the stigma associated with sexually transmitted infections. Our objective for today is to provide an overview of the Medicare preventive services for sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections. And we will cover background information about STIs, a description of the Medicare covered services of sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections, and the Medicare Part B coverage criteria for sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections. Let's first start with some facts about STIs. According to the Centers for Disease Control and Prevention, around 2.4 million cases of syphilis, gonorrhea, and chlamydia were diagnosed in 2023, and this includes more than 209,000 cases of syphilis, 600,000 cases of gonorrhea, and 1.6 million cases of chlamydia. In the United States, approximately 20 million new cases of sexually transmitted infections are reported annually. STIs often present with no symptoms, which can delay treatment and diagnosis. As a result, individuals may unknowingly transmit STIs to others. Preventive screening and counseling to those at high risk for STIs helps identify and manage different types of sexually transmitted infections, assisting Medicare beneficiaries in protecting their overall health and well-being. Certain behaviors can place a person at a higher risk for contracting a sexually transmitted infection. These risk factors include having unprotected sex, as well as not consistently using barrier protection, having multiple sex partners, participating in high-risk sexual behaviors regardless of age, being under the influence of alcohol or drugs, trading sex for money or drugs, beginning sexual activity at a younger age, and this includes the higher risk of chlamydia and gonorrhea for sexually active women aged 24 and younger, and having a history of sexually transmitted infections. Additionally, African American, Hispanic, American Indian, and Alaska Native populations tend to experience higher rates of sexually transmitted infections compared to white populations. Factors that may contribute to this issue include poverty, inadequate access to quality health care, limited treatment options, and social stigma. So let's now start by discussing the sexually transmitted infections for which Medicare covers screenings under the Medicare Preventive Service benefit. And we will start with chlamydia. Chlamydia is the most common bacterial sexually transmitted infection. It is usually spread through sexual activity, but it can be passed on from a mother to her baby during delivery. Symptoms may include abnormal discharge from the vagina or penis, burning during urination or dysuria, and rectal pain and bleeding. In addition, women may also have spotting or bleeding between periods and after sex, and painful sexual intercourse. Men may also present with painful or swollen testicles. However, chlamydia is often asymptomatic, making it easy to spread as many individuals are unaware that they are infected. In women, untreated chlamydia can cause permanent damage to the reproductive system, potentially resulting in infertility or increased chance of ectopic pregnancy. In men, untreated chlamydia can lead to inflammation of the epididymis. Depending on the location of the infection, screening and testing for chlamydia are performed through a sample of urine or by collecting a swab of fluid from the urethra, vagina, throat, rectum, or eye. Treatment for chlamydia involves use of antibiotic therapy. Patients should be advised that sexual activity should be avoided until all symptoms are gone. All exposed partners should be tested and treated for chlamydia as well. The next sexually transmitted infection is gonorrhea. Gonorrhea is a bacterial sexually transmitted infection. It's commonly spread through sexual activity, but it can spread to infants during birth and cause an infection to the baby's eyes. Like chlamydia, gonorrhea is often asymptomatic. However, if symptoms are present, they may include abnormal discharge from the vagina or penis, burning during urination or dysuria, rectal pain and or itching, rectal bleeding or discharge, eye pain or sensitivity to light, discharge from the eye, sore throat, swollen lymph nodes, and painful red and swollen joints. In women, additional symptoms may include abdominal or pelvic pain and bleeding between periods and after sex. Men may also present with swelling or pain in one testicle. In women, untreated gonorrhea can lead to scarring of the fallopian tubes, infertility, increased chance of ectopic pregnancy, and long-term pelvic and abdominal pain. In men, untreated gonorrhea can lead to inflammation of the epididymis and infertility. Screening and testing for gonorrhea are performed through a sample of urine or a swab of fluid from the urethra, vagina, throat, rectum, or eye. As with chlamydia, treatment for gonorrhea includes use of antibiotic therapy. Patients should be advised that sexual activity should be avoided until all symptoms are gone. All exposed partners should be tested and treated for gonorrhea as well. Additionally, patients that are diagnosed with gonorrhea should be retested around the 3-month mark after they've finished treatment. The last sexually transmitted infection included in this preventive service is syphilis. Syphilis is a bacterial sexually transmitted infection. It's usually spread through sexual activity, but it can be passed on from a mother to her baby during pregnancy. Patients may not realize they have syphilis, as the bacteria can stay in the body for years without causing symptoms. In the early or primary stage of syphilis, the patient typically develops a small, painless sore known as a chancre. If left untreated, primary syphilis will develop into secondary syphilis. In the secondary stage of syphilis, the patient commonly develops a non-itchy rash, which can appear on various parts of the body, including the chest, abdomen, pelvis, back, limbs, hands, and soles of the feet. Other symptoms during secondary syphilis may include sores in the mouth or genital area, muscle aches, sore throat, fatigue, fever, swollen lymph nodes, hair loss, and weight loss. If the secondary syphilis remains untreated, the patient will develop latent syphilis. In the latent stage of syphilis, the patient is asymptomatic. This stage can persist for years. However, if left untreated, it can lead to serious complications and health problems. Tertiary syphilis may develop in some individuals if the infection remains untreated. It can cause damage to various organs, including the brain, spinal cord, nerves, eyes, liver, heart, blood vessel, bones, and joints. Screening and testing for syphilis are performed through a sample of blood, a swab of fluid from the sore, or a sample of cerebral spinal fluid. A single injection of penicillin is recommended for the treatment of all stages of syphilis. Additional doses of penicillin may be given if the person has had syphilis for longer than a year. If the person is allergic to penicillin, another antibiotic may be given. Following treatment of syphilis, the patient should have regular follow-up testing performed to ensure the penicillin has effectively treated the infection. Patients should be advised that sexual activity should be avoided until all symptoms are gone and the infection is cured. All exposed partners should be treated for syphilis. Also, exposed partners should be tested for syphilis and treated if needed. Before we move on, I'd like to take a moment to briefly discuss 3 additional sexually transmitted infections. Although they're not part of this preventive service, Medicare does cover them as part of its preventive services benefit. The first sexually transmitted infection we will discuss is hepatitis B. Hepatitis B is a viral infection of the liver caused by the hepatitis B virus. It can be classified as either acute or chronic. Acute hepatitis B typically lasts 6 months or less. Most people with acute hepatitis B infection will recover fully. Chronic hepatitis B persists for more than 6 months. It can result in liver failure, liver cancer, or cirrhosis of the liver. Although hepatitis B can be prevented with the hepatitis B vaccine, it cannot be cured, unlike other sexually transmitted infections. Testing for hepatitis B includes blood tests to detect the presence of the hepatitis B virus in the body, liver ultrasound to determine the extent of liver damage, and liver biopsy to check for signs of liver damage and liver impairment. Symptoms of acute hepatitis B infection may include abdominal pain, joint pain, nausea and vomiting, weakness and fatigue, fever, dark urine, jaundice of the eyes and skin, and loss of appetite. For acute hepatitis B, treatment may involve getting plenty of rest, following a balanced diet, staying well hydrated, and closely monitoring the patient's recovery as they combat the infection. The goal of treatment for chronic hepatitis B is to slow the progression of liver disease and prevent the transmission of infection to others. People with chronic hepatitis B will require lifelong treatment of the disease. Treatment options may include antiviral medications, interferon injections, or liver transplant. Please note that although hepatitis B screening is listed under the sexually transmitted infection screening and high-intensity behavioral counseling to prevent STIs section of MLN 006559 Medicare Preventive Services chart, it is actually covered as a separate preventive benefit under the hepatitis B screening. And CMS has provided a clickable link to the hepatitis B screening within the STI screening and HIBC to prevent STIs in section under the Medicare Preventive Services chart. For more information about hepatitis B screening, including coverage information, please view our Encore presentation titled Encore Preventive Services for Hepatitis B and C. The next sexually transmitted infection is HIV infection. HIV, or human immunodeficiency virus, is a condition caused by a retrovirus that targets the immune system. HIV is mainly transmitted through direct contact with specific bodily fluids from an infected person with a detectable viral load. These fluids include blood, breast milk, semen, preseminal fluid, vaginal secretions, and rectal fluids. Transmission can occur through sexual activity, injection drug use, or from a mother to a baby during pregnancy, childbirth, or breastfeeding. HIV treatment involves antiretroviral therapy, or ART, to control the virus and reduce the viral load by inhibiting HIV replication. ART consists of a daily combination of medications to manage HIV. It can be taken orally or administered through injections. When taken as directed, ART can help reduce mortality and morbidity in individuals living with HIV by strengthening the immune system, reducing the HIV load in the body, lowering the risk of transmitting HIV, and preventing the progression of HIV to acquired immunodeficiency syndrome, also known as AIDS. Individuals living with HIV who maintain an undetectable viral load have an extremely low risk of transmitting HIV to their HIV-negative partners through sexual contact. And this concept is known as U equals U, or undetectable equals untransmittable. ART also plays a key role in increasing the life expectancy of individuals living with HIV. Antiretroviral therapy is a lifelong treatment regimen. It is crucial for all individuals living with HIV to continue their antiretroviral treatment, even if the viral loads drop to undetectable levels. There are two types of preventive medications available to lower the risk of HIV in individuals at high risk of infection. Pre-exposure prophylaxis, or PrEP, is used to reduce the risk of HIV in individuals at a higher risk of infection. Individuals must be HIV negative to start PrEP. When taken as prescribed, it's highly effective in preventing HIV. Post-exposure prophylaxis, or PEP, is administered to prevent HIV after a potential exposure. PEP must be started within 72 hours of a possible HIV exposure. It is also highly effective in preventing HIV when taken within this time frame. The last sexually transmitted infection we will discuss is human papillomavirus, or HPV for short. Persistent infection with certain strains of human papillomavirus is identified as the main cause of cervical cancer. Out of more than 100 HPV genotypes, around 15 are considered high risk. High-risk genotypes, particularly HPV types 16 and 18, are responsible for most cervical cancer cases. HPV type 16 is linked to 50% of cervical cancers worldwide, and together, types 16 and 18 account for approximately 66% of cervical cancer cases. Usually, the immune system clears the HPV infection within 1 to 2 years. However, in a small percentage of women with HPV, the virus can lead to abnormal changes in the cervical cells. If these precancerous lesions are not properly treated, they may develop into cervical cancer. HPV infection is preventable. There are several different preventive measures available to help reduce the risk of cervical cancer caused by HPV infection. The first preventive measure is through cervical cancer screening. Pap tests help detect abnormal cell changes in the cervix and precancerous conditions. HPV tests identify high-risk HPV infections. Both tests allow healthcare providers to address these issues before they develop into cervical cancer. The next preventive measure is getting vaccinated against HPV. HPV vaccines such as Gardasil and Cervarix have received approval from the Food and Drug Administration. The vaccine is approved for use up to age 45. HPV vaccination is typically recommended for individuals ages 9 to 26. However, individuals over age 26 who have not been previously vaccinated and are at risk for new HPV infection may still be eligible for the vaccine. The last preventive measure we will discuss is use of condoms. When used correctly, condoms can reduce the risk of certain sexually transmitted infections, including the possibility of potential transmission of HPV. However, condoms do not fully eliminate this risk. For more information about HPV and cervical cancer screening, including coverage information, please view our Encore presentation titled Encore Cervical Cancer Screening Clinical. Remember, sexually transmitted infections can be prevented. There are several recommendations for the prevention of sexually transmitted infections. The first is abstinence. This is the most effective way to prevent sexually transmitted infections. The second preventive recommendation is use of condoms. When used properly, latex condoms are an effective way to prevent the transmission of sexually transmitted infections. Non-latex condoms can also be effective, though they are more likely to break than latex condoms. Natural membrane condoms are not recommended for preventing sexually transmitted infections. The next preventive recommendation is vaccinations. Vaccinations are available to help prevent or reduce the risk of contracting certain sexually transmitted infections, such as hepatitis B and human papillomavirus. The fourth preventive recommendation is to advise patients that they can reduce their exposure to sexually transmitted infections by limiting the number of sexual partners. It's important to emphasize to patients that both they and their partners should be tested for sexually transmitted infections and that the results should be shared with each other. Practice monogamy is the fifth preventive recommendation. Maintaining a committed, long-term monogamous relationship with an unaffected partner is the most reliable way to prevent the spread of sexually transmitted infections. Finally, it's important for individuals to get tested for sexually transmitted infections to know their STI status. It's also essential that they seek treatment if needed after STI testing. The Centers for Disease Control and Prevention has created a resource to guide clinicians on sexually transmitted infection screening, treatment, and effectively communicating patients about their sexual health. A link to this resource is provided on the bottom of this slide. So now let's talk about coverage criteria for the Medicare covered preventive services of sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections. Sexually transmitted infection screening consists of laboratory testing to detect the presence of infection from Chlamydia, Gonorrhea, and Syphilis. Medicare will cover these screenings if the following criteria is met. Screening is performed using FDA-approved laboratory tests in accordance with FDA labeling and CLIA regulations, and the screening tests are ordered by a primary care physician or practitioner and performed by an eligible Medicare provider. High-intensity behavioral counseling to prevent sexually transmitted infections is a program designed to promote the reduction or avoidance of sexual risks by offering education, skills training, and guidance on modifying sexual behavior. The counseling should align with recommendations for the United States Preventive Services Task Force. The U.S. PSTF assigned a grade of B for behavioral counseling to prevent sexually transmitted infections for sexually active adolescents and for adults at an increased risk. A link to the U.S. PSTF's Sexually Transmitted Infections Behavioral Counseling has been placed on this slide if you'd like to read more about the recommendations for the United States Preventive Services Task Force. The U.S. PSTF recommends using a variety of methods to deliver the information, including in-person counseling, videos, websites, written materials, telephone support, and text messages. Topics that may be discussed include common STIs and how they're transmitted, risk factors for sexually transmitted infections, skills training, guidance on safer sex practices, and problem-solving techniques. Medicare will cover high-intensity behavioral counseling to prevent sexually transmitted infections if the patient is referred by a primary care provider and the service is provided by a Medicare-eligible primary care provider in a primary care setting. Prior to completion of sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections, ensure the patient has met the eligibility and frequency criteria for these services. You can find more information about screening for STIs and HIBC to prevent STIs in the National Coverage Determination, NCD 210.10, Screening for Sexually Transmitted Infections and High-Intensity Behavioral Counseling to Prevent STIs. And a link to this NCD can be found on the resources slide at the end of the presentation. Patients with Medicare Part B who meet the following criteria are eligible for sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections. sexually active adolescents and adults who are at increased risk for sexually transmitted infections and have been referred by a primary care provider, and the services need to be ordered by a primary care provider or physician or practitioner and provided in a primary care setting by a Medicare eligible primary care provider. Per NCD 210.10, a primary care physician is defined as a general practitioner, family practice practitioner, general internist, or obstetrician or gynecologist. A primary care practitioner is defined as a physician specializing in medicine, internal medicine, geriatric medicine, or pediatric medicine, or as a nurse practitioner, clinical nurse specialist, or a physician assistant. According to MLN 006559 Medicare Preventive Services, CMS defines a primary care setting as a location where clinicians provide integrated, accessible healthcare services, manage most patient needs, build long-term patient relationships, and work within the context of family and community. CMS also specifies that primary care settings do not include emergency departments, inpatient hospitals, ambulatory surgical centers, independent diagnostic testing facilities, skilled nursing facilities, inpatient rehabilitation facilities, and hospices. Links to NCD 210.0 and MLN 006559 can be found on the resources slide at the end of the presentation. Medicare covers one screening annually for chlamydia, gonorrhea, and syphilis in non-pregnant women at increased risk for these infections, and one screening annually for syphilis in men with increased risk for this infection. Medicare also covers up to 2 individual 20 to 30-minute face-to-face high-intensity behavioral counseling sessions per year for all sexually active adolescents and for adults at increased STI risk. High-intensity behavioral counseling to prevent sexually transmitted infections, G0445, is a time-based code. Additionally, for pregnant women, Medicare covers up to 2 screenings per pregnancy for chlamydia and gonorrhea for those at increased STI risk, with a possibility of second screening if the woman continues to be at increased risk, and 1 screening of syphilis per pregnancy, with up to 2 additional screenings during the 3rd trimester and at delivery if at continued risk for STIs. For both these preventive services, there is no copayment, coinsurance, or deductible if the healthcare provider accepts assignment. When assessing a patient for the potential need for STI screening and high-intensity behavioral counseling, the primary care provider should first gather and review the patient's sexual history to assess their risk for sexually transmitted infections. And this is typically done during an annual wellness exam or prenatal visit as part of the overall medical history. Based on the information collected during the sexual history portion of the exam, a personalized healthcare plan should be created for the patient. This may include STI screening and counseling when indicated. High-intensity behavioral counseling to prevent sexually transmitted infections may be administered on the same day as an annual wellness visit, evaluation and management service, or within a global billing period for obstetrical care. However, it's important to note that only one instance of high-intensity behavioral counseling may be provided on a given date of service. When documenting sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections, be sure to include the date the service was provided, office visit notes for the date of service, referral by a primary care physician or practitioner for high-intensity behavioral counseling, signed and dated physician or qualified non-physician practitioner order for the laboratory services performed, test results and documentation of any follow-up care or counseling that was given following evaluation of results, documentation the counseling intervention was provided by a Medicare eligible primary care provider in a primary care setting, and documentation to support the medical necessity of these preventive services. Ensure all documentation is dated and signed with the provider's credentials. High-intensity behavioral counseling, G0445, is telehealth eligible. The requirement can be met through audio-only interaction. Additional information on coding for sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections can be found in the Medicare Claims Processing Manual, Chapter 18, Preventive and Screening Services, Section 170. Before we finish up, I want to discuss a question we often receive regarding the coverage of specific preventive services when delivered in rural health clinics and federally qualified health centers. Under the Affordable Care Act, Medicare covers certain preventive services, including those provided in rural health clinics and federally qualified health centers. The Affordable Care Act includes preventive services recommended by the United States Preventive Services Task Force and ensures patients do not incur out-of-pocket costs such as copays or deductibles for these services. Under ACA guidelines, syphilis screening and STI prevention counseling are covered for men at an increased risk of infection as part of the preventive services benefit for sexually transmitted infection screening and high-intensity behavioral counseling to prevent STIs. For non-pregnant women, chlamydia, gonorrhea, and syphilis screenings are covered for those at increased risk for these infections, along with STI prevention counseling. For pregnant women, chlamydia, gonorrhea, and syphilis screenings are also covered, as well as STI prevention counseling. Medicare will cover preventive services provided by both RHCs and FQHCs as long as these services are provided in a primary care setting by a Medicare-eligible primary care provider. This would include any qualified primary care physician or other primary care practitioner that falls under the CMS definition of an RHC or FQHC practitioner. For more information on preventive services and coverage in RHCs and FQHCs, please refer to MLN 006398, Information for Rural Health Clinics, and MLN 006397, Federally Qualified Health Centers. Links to these resources can be found on the resources slide at the end of the presentation. Many sexually transmitted infections can be prevented and treated, with a substantial number being curable. Offering STI screening and high-intensity behavioral counseling to prevent sexually transmitted infections is one way you can help your Medicare patients reduce the risk of STIs. So as a recap, during today's webinar, we provided background information about STIs, described the Medicare covered services of sexually transmitted infection screening and high-intensity behavioral counseling to prevent sexually transmitted infections, and reviewed the Medicare Part B coverage criteria for STI screening and HIBC counseling to prevent sexually transmitted infections. This slide contains resources related to the information we discussed today. You will find links to the section on sexually transmitted infection screening and high-intensity behavioral counseling to prevent STIs under MLN 006559 Medicare Preventive Services Chart, as well as NCD 210.10 for screening for sexually transmitted infections and high-intensity behavioral counseling to prevent STIs. Additionally, it includes links to the MLN booklets for rural health clinics and federally qualified health centers. Please take a moment to review this slide and use it as a reference when reviewing the presentation. For those attending today's live event, in a few minutes, you will receive an email thanking you for attending. The email will look like what you see on your screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as a link to take the survey. And if you haven't completed it already, please take a few moments to complete this customer satisfaction survey. The contact hours for this event can be found in the email should you require them for earning credit to continuing education units. If you don't see it, please check your junk or spam folder. Make sure to add the WebEx email address messenger@webex.com to your safe sender, safe receiver list to avoid these emails going to junk or spam. If you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. Following today's live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put STI screening and counseling clinical in the subject line. However, if you have claim-specific questions, please do not send those to Provider Outreach and Education. Please direct those questions to our customer service department, as we do not have access to your claim information and therefore are unable to look up claims. Also remember, we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us about your experience, including what you liked and what we could do to improve, and suggestions for future education. Your feedback really is invaluable in helping us deliver the education you need. We use your feedback to develop topics for future education events. There are several different options you can use to take the survey, depending on your preference. For those attending today's live event, the first option is to click the survey link in the chat. The other option is to take the survey with the CMS Qualtrics page. When you exit the webinar, you'll be asked to go to an external site, and the external site is the CMS Qualtrics page for the survey. And that message or that pop-up, look sort of what you see right here with the little yellow triangle. That site is not spam, it's actually directing you straight to our survey. We will also add a survey link to the Encore presentation. Just click on the survey picture at the end of the Encore presentation video to take our customer satisfaction survey. On behalf of myself, Mary Sue, and all provider outreach and education, thank you for attending today's webinar on STI screening and counseling. As a reminder, this presentation will be posted as an Encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.